Okay, this morning we want to talk about the zones in the theater. We talk about the zones in the theater for the following reasons. One is for infection control. Do you understand? We want to control infection. We want to maintain sterility, and then we want to work to flow very well. That is why we talk about the zones or areas in the theater. So the zones in the theater are divided into four. They are divided into four, and I've told you the reason why they are divided, why we maintain zones: for sterility, control infection, and for workflow, for it to work effectively. The first zone is known as the unrestricted zone. Unrestricted, that's the zone one. You know, it is a zone that you can come in with your outdoor wear, like the way you come in this morning. You came in with your outdoor wear. Am I right? So you came in with your outdoor wear, and then you entered the changing room and you changed. You understand? So zone one, or unrestricted zone, is the zone for the passage of personnel, patients, and equipment into the theater. You see that door you crossed this morning? That is the passageway for even the patient. When the patient is coming in, if any equipment coming into the theater, then any personnel coming into the theater, that is the zone. It is not controlled. You understand? So the areas that are found in this zone one: number one, the waiting room. A patient relative, they have to wait. You understand? Then the reception area, the patient has to be received. So when a patient is coming for any surgery, the patient will first of all be at the reception area. The patient will be received. That is where you check whether everything for surgery, whether they are all ready, whether consent was obtained, whether he did his investigations, whether is the right patient. That's where you do patient identification to know whether this patient that has been brought is actually the right patient for the surgery. So it's at that patient's reception area that you do your identification and check everything before patient enters. So I said zone, unrestricted zone or zone one, you have the waiting room, you have the reception area, you have the changing rooms. All personnel, when they come in with your outdoor wear or the street clothes, you now enter the changing room and go and do what? And change. Then the offices. You have the doctors' offices, nurses' offices, all the offices are there in zone one. You understand? So the second zone, semi-restricted, is a semi-restricted. It's also known as substerile zone. So in this zone, you must be, it's a control zone somehow. So patient relatives are not allowed into this zone, just where we are now. This corridor, that is semi-restricted. And how we demarcated zone one from zone two is by that red line you have seen. We marked a red line. So the demarcation between zone one and zone two is what? The red line. So anytime you are coming here and you see a red line, that means you should not cross the red line to semi-restricted. You understand it? So never you use your outdoor wear or your footwear and cross that zone. So when you have changed in the zone one, you now wear your cap as I'm wearing. So for zone two, the requirements cap, you wear your cap. You now wear your Crocs. That is the footwear designated for the theater. If you don't have Crocs, we have our what? We have our foot wear that you can wear. Shoe cover. This is shoe cover that you can use and cover your shoe. So for zone what? Two. I said zone for zone two, that's semi-restricted. You must have changed from your outdoor wear to your what? Theater attire, the way I am. You're wearing your scrub, you're wearing your cap. It's only when you want to touch a sterile supply, that is when you are required to wear your mask for zone two. So the areas that are in zone two are the corridor. This is the corridor that leads to the suits. The corridor that leads to suits, that's the procedure rooms. Then you have the recovery room. It's a controlled area. Semi-restricted is a controlled area. So you have the recovery room. You have the corridor leading to the suits. You have the substerile area. You have the area, the room where we keep our sterile what instruments. Is all in zone Two. Then you have the third zone, which is the restricted zone. You have to be properly attired. You must wear your cap, you must wear your Crocs, you must wear your mask. Your mask must be on. That is where high level of SFCs is applied. That is in zone 3 or restricted zone. You have to wear your cap, you wear your mask, your scrub, your Crocs or your shoe cover. You have to wear it for you to access zone 3 because we maintain high level SFCs there. We don't want infection on any patient's wound. You understand? You understand? So in zone 3, that is where we maintain, you have accurate theater temperature. It's usually cold. The humidity is 60 to 70%. The temperature is 21 to 23. It's usually cold. So you have to, and your conduct there is that you don't want to compromise sterility. So inside the zone 3, that is where you have the scrub area, where you scrub before you now gown and then go for this assist for the surgery. The surgeon, they do so. They also scrub. So the scrub up room, the setup room, the room, the operating room itself where you operate, they are all in zone 3 or the restricted zone. So it's quite controlled. Not everybody is allowed inside that zone. So the last zone, that's the disposal zone, zone 4. You know, all the waste generated inside the suit, inside zone 3, it has to be taken out. So you take it out through the disposal zone. So, and there has to be limited access. There you just avoid a kind of contamination so that people will not be infected when you are disposing the waste generated. So we have been able to establish the zones in the theater, and we said that we have how many zones? 4 zones. Zone 1, zone 2, zone 3, and zone 4. Zone 1 is what? Unrestricted zone. Zone 2, semi-restricted. Zone 3, restricted or sterile zone. Then zone 4 is the disposal zone. So your conduct there, and I've told you the conduct there, all these things are geared towards maintenance of sterility, to prevent infection, and for workflow to go, for work to go well. Thank you very much. I want you to like and share so that others will benefit. Bye.